Did you know psychology or counseling is an option after BDS? Yes, it is. And to tell us more about the field, we have with us Dr. Disha. She is the founder of Disha Council, and her vision is to maximize the quality of lives of people globally by providing responsive and effective mental health care. She is certified in RECBT from Affiliated Center of Albert Ellis Institute, New York. She writes regular blogs and holds talks on mental health. She also holds the position of counselor and a member of the Sexual Harassment Committee at the prestigious NIFT Kangra. And today she's going to tell us how she made the jump from being a BDS dentist to becoming a psychological counselor. Hi, Dr. Disha. Thank you for taking your time and joining us out here. You're one of the few who have taken a totally different path and is creating a name for herself in it. So, I would like to ask you questions of how you decided to go into such a different path after BDS. My first question to you is, how did you decide that dentistry is not what you want to do, and why did you decide to quit it?
Hmm. First of all, thank you so much, Dr. Satish, for having me here. And the first question is the toughest for me because this path of separating from the dentistry didn't come actually very easily to me. Internship During the internship only, I had this idea that maybe opening the clinic or being into the practice is not a good option for me. I was always, good in the other subjects like general surgery, pathology, or even community dentistry. Those subjects I used to like.
Okay.
But when it came to going to prosthodontic or extraction, I was so anxious. I don't know. I somehow felt that it was not meant for me. So from the internship, when you are into that zone, what after BDS, you have that what after BDS. So searching for options. So I searched for many things. For an example, MBA in hospital administration, in MPH, public health. So everything I used to explore other than opening up a clinic option. And as I said, it didn't came easily to me. It almost took 5 to 6 years for me, Dr. Satish. So during those 5 to 6 years, to justify my degree, I used to practice in hospitals, I used to practice in
Okay.
clinics. I did all that. Side by side, I was trying and fumbling. I tried for, as I said, MA, MPH, and even I worked for Potties for some months as a medical officer also.
Oh,
Didn't like it at all. So tried giving UPSC to under influence of my husband, but that obviously not for me. So I did try many things, and later I came up to this profession, and this is where I finally found my calling. You can say.
but how did you end up in counseling? No, non-clinical, I can understand MBA you tried, I can understand you tried MPH,
Yeah.
everything,
So yeah,
UPSC.
this is
But
totally
how did you end up
different.
in
I know.
counseling? Yes, how did you end up
This
there?
is totally different. So it's very interesting. There are two things which happened. First of all, as I said, I was from the starting, I was dissatisfied with what I was doing because it was not what I wanted to do for the lifetime. Okay. So as you know, with that dissatisfaction with your work, person tends to get very stressed and depressed overall in your own life. So I had that depressed feeling for a very long period of time. And for that, I seek a counselor. So when I seek counseling for my depressed feeling, it came out that I used to blame all other things, my relationships and etc. for my depressed feeling. But I realized that it was actually my work dissatisfaction or a dissatisfaction with my own career was the cause or the contributing factor for my depressed feelings. And from there, I understood now or never. Like I have to do something. If I continue doing, working as a dentist in hospitals and everything, I will, go mad if I just continue doing that. That was the turning point, and I actually got myself career counsel, literally career counsel at the age of, you can say, 29. When people get career counsel at the age of say 20 or even 17. So I got career counsel, and this was one of the options suggested to me, psychology. And I have an aptitude personally also. I was always a philosophical kid. So if you ask my friends, they would always describe me as very empathic, patient, understanding, who has very good listening ear. These are the qualities always my friends will mention to me. And I knew that I had that in me. Sometimes it just clicks. So
So you
this
were the
was the
agony
click
aunt
for me.
for everyone around you.
Oh, no, no, not really. But yeah, so in a way, and that click happened. I clicked with this. And when I, so the second thing, one was this career council, and I went to council. Second thing, which actually helped me to switch this, was during my pregnancy break. So when I got pregnant, I had to take a break from clinical practice because I was advised bed rest for a few months, and there I got a chance. So there I read a lot about psychology, counseling, because changing field is very tough decision. It is a tough decision. You are answerable to your own parents, to everybody around you, and to make that switch was not easy, as I said. So during that break, when I was not working, I read a lot of things, and then I understood, okay, this is what I'm liking, and I can do a lot good in this field.
Understood. So how was the response of your friends and family and peers when you told them you're going to move out of dentistry completely and get into psychology?
Okay, surprisingly, it was good and positive. Like, I was very scared. That cliche thing, that log kya kahenge types, that always on the back of my mind, ki log kya kahenge. And especially more than log, it was about parents. Because parents always, they have put a lot of money, a lot of efforts, their time, their dreams. हमारी बेटी डॉक्टर बनेगी, हमारा बेटा इंजीनियर बनेगा टाइप्स, हमारी बेटी डॉक्टर बनेगी. So they had that thing, and because of them, I at least have a degree of, I can call myself as a doctor. It's because of them. So I was hugely answerable to them. So to reveal it to them was the very difficult time for me. And for the starting, it didn't go well with them, obviously, for the obvious reasons. They are Indian parents, and so and we are quite used to the thing that engineers turning to MBA, engineers turning to startups, engineers going for banking jobs. But doctors doing this is not yet become a norm so far.
Yes.
We are used for the engineers to do so. So when I revealed that, was yeah. So this initial turmoils isn't, they didn't say no, but they were not really happy, obviously, for the obvious reasons. But they did support me, like, do whatever feels good for you. They were supportive in that way. And then I started, and now they are proud of me. They are happy to see what am I doing in my life. Yeah.
Great. That's really great. So how did you make that shift? What course did you do? How did you become a knowledgeable person in the field of counseling and psychology? Before you listen to the answer to that question, do not forget the guests take out time from their schedule to explain you their career trajectory. So please do not forget to hit the like button below.
Okay, so as I said, I started first reading by myself about this profession, and before doing any professional courses. So I started reading about this field a lot, and then I did a course, proper courses. So I signed up for a master's in psychology from IGNU. Then I did. There is something called as, not many people know, called as cognitive behavioral therapy. So in
CBT.
India, we are CBT. Yes. How great, CBT and REBT. Okay.
Yes.
So in India, we don't still on a very back foot regarding the mental health and what are the therapies available. But in Western countries, this is one of the most commonly practiced and evidence-based therapy. Okay, CBT and REBT, the cognitive behavioral therapy. So I got certified in that, and also I took a counseling diploma, and with all this degrees and knowledge, I started my practice 2 years back.
Understood. That is about the studying part of it. But you might have surely faced
Yes.
some difficulties when you had to make this jump because of the dental background, learning something totally different. So, what were the
Yes.
difficulties you faced and how did you overcome them?
Okay, so first, people knew me as a dentist. So I had to make that shift of image also. And it is not yet completely happened so far also, because still people identify me as a dentist many a times. But that gradual shift happened because I posed myself as a psychotherapist and counselor over all the social media platform. First things, because we are in thankfully in the social media age where we have to take less efforts to reach out to people. So everybody's favorite app, Instagram, was my go-to to start with it. So Instagram, YouTube, website of my own, Facebooks, all were the platforms where I started putting a lot of content of my own to make me as a available as a psychotherapist and a counselor. And from the post, from the contents, people relate to you, then they reach out to you. So say from the time I started posting, after the 6 months you get your first client, same as you're opening a clinic. After few months you get some footfalls. Similarly, the struggle is same everywhere. So that way, social media was my major. And also I went offline to give talks to schools, in colleges I still go for talks and yeah, webinars.
Understood. You had a dental background before psychology. Is there any way in which the dental background helped you in your psychological career?
Dental background, see, as you also know, it's about health as a umbrella topic. So we learn a lot about health, body basics. So because psychology is also, I will not say totally off career, it's also again a health. It deals with the health of a person. So that common knowledge which got from the dentistry, as being a doctor, you have some basic idea about, about chemicals, about hormones, how body works. It very much applies to also the mental health arena. So that part used to grasp much more faster than a non-medical person would be, you know, uh, doing. And also interestingly, now that you mentioned what would be the, thing between dental health or a mental health, or dental field or a mental field, I remembered something is that just a few 1 or 2 months back, I went to this dental college, Karmic Dental College, for a to give a talk to undergrad students. Okay, and there I shared this interesting thing with them, that how in the our dental field, the person normally goes to dentist when the tooth is gone for the root canal. He prolongs, and then when it gone for RCT, then he will go to the dentist and get the RCT done. Almost similarly in the now my field, mental health also happens that unless you are like mental breakdown, then only a client comes to me in that stage. Now that I have mental breakdown, now I go to counselor. But the only
Understood.
difference between these two fields is that you don't shy away to tell that I have a dental pain, but you have a lot of shy when you tell somebody that I have a mental pain. That stigma is
Understood.
there, which I have to fight extra in this field, in mental health field. And sorry to interrupt you, but I have something to add on to what you said. That dental field say to contribute to my new field, वो तो है ही, that is there. But also from this new field, I have learned something which I would like to actually implement in the dental field. uh, we know a lot about tobacco addictions, right? So
Yes.
we there is public health, there's a lot of work going on around tobacco addictions. So when I learned about psychology, counseling, and therapy, I realized that it is not just about education, awareness. This addiction part is totally psychological. If we can bring a psychological perspective to this, counseling or a therapy to tobacco de-addiction programs, it could escalate, its effect. I think so. So
100%.
it's on my mind that being on a both sides, I have seen both sides, the tobacco addictions and the psychological perspective of addictions. I think I can. This is on my mind. How I can contribute to dental field now from this knowledge.
No, that's a very good point because we have realized that just by a dentist telling a patient you're not supposed to smoke, that does not happen. There are someone who
That
needs
doesn't.
to go and understand the underlying reason and psychologically try and make him understand. So that's a absolutely good suggestion you have there. And I'm sure you'll do a lot more in that field as well. My question to
Yes.
you is, if someone is planning to take the route you have taken and get into psychology or counseling after BDS, okay, what would be your suggestion to them?
Okay, so this is also a very vast area. Like there are multiple therapies. There is also multiple ways to go into this field. Okay, and but first of all, the same thing as I was lost kid, so much so that I did not understood what exactly to do. But first of all, why you want to do this? This is the first and foremost important, not just because somebody says that there's a lot of money in this field or this is easier field. So don't go by those notions. uh, First thing from my side as a suggestion. Second thing, always go for authentic degrees in this field. Particularly, there are a lot of um, non how should I put it, quacks, as we say in the dentistry. Okay, so
Understood.
there are also lot of not really authentic courses available, okay, in this field. So
They just give
always
you the
go
certificate
for
for the heck of it.
heck of it. So
Yes.
literally 15 days or 10 days online courses this they offer, and you can practice as a counselor just like that after 10 days. There are such things available. But I if you really want to go for this field as a lifelong profession, go for authentic courses, evidence based therapies, and obviously psychology degree would be to start with. And it's not that difficult to to sound like a degree and certificates. It's really possible with distant learning also.
Understood. Uh, I am very thankful that you've taken your time and come to our platform and giving such good advice to our students out here. Because this is a career which a lot of people do not talk about, and you have gone there and done it. And I wish
Okay.
you a lot of success in your future, Dr. Disha. Thank you for being with
Thank you
us.
so much, Dr. Satish. On the last point, I would add one thing. While doing this, uh, learning for this profession, you will be surprised that I made at least 3 to 4 dentists in a group of say
Wow.
20 people who were doing it. Surprisingly, seriously, there are I made 3 dentists all in the same batch, by the way, who were doing this course with me.
So a lot of dentists are shifting from dental pain to mental pain. That's good.
That's nice way to put it. Yes.
Yeah. Thank you, Dr. Disha. Thank you for being with
Thank
us.
you so much, Dr. Satish. Thank you.